Well, new data out today from the Canadian Institute for Health Information is highlighting the strain on the country's healthcare system. It says 1 in 10 Canadians, or about 1.5 million overall, are forced to wait 14 hours when they visit an emergency room. And people who are admitted to hospital could be in the ER for more than 2 days. The report says limited ER capacity, difficulties in accessing standard care, and the country's aging population are to blame for the worsening backlog. So what are some of the lead factors, we've touched on some there, that is leading to these long ER wait times? And what needs to be done? For more on that, we've reached Dr. Michael Herman in Ottawa. He's an emergency physician and spokesperson for the Canadian Association of Emergency Physicians. Thank you for making time for us today.
Thank you so much for having me. Appreciate it.
So first, I want to ask you, what was your reaction when you saw the data that came out in this report?
Well, I wish I could say it was surprise, but honestly, if you ask anybody who's been working on the front lines for the past 5 years, you know what it's like, and you know that this data really reflects what we're seeing. We're seeing a sicker, more medically complex population, and we're seeing a population that is staying more and more in the emergency department after they're being admitted, to their detriment and to the detriment of the department itself.
When we talk about the numbers that have come out of this study, saying 1 in 10 Canadians, or about 1.5 million, are waiting 14 hours, you mentioned that that's not surprising, and some of the factors there, that we've got an aging population, that the access to care is more difficult, partially because of the resources. What needs to be done right now?
Well, the biggest obstacle in terms of flow in the emergency department is flow out of the emergency department. So where we really struggle the most nationwide is getting the patients in the emergency department who were admitted to the inpatient wards. And they're in turn blocked by patients who are admitted needing complex medical care themselves, or patients who are alternate level of care, ALC, who have completed their medical treatment but need disposition either at home with community supports or rehab or long-term care that just doesn't exist. So we need to be investing in strategies that will allow the outflow from the hospital to proceed so that the inflow into the emergency department can continue as intended.
You know, I know that this report is doing a comparison here between 2018-2019 fiscal year to 2024-2025. And when we were talking, you mentioned the past 5 years, if you look at back then to now. You know, for me, when I think about this, this is something that we've been reporting on for decades, that we were expecting this because there was a big population that was aging. We knew that this was happening. People get older. There's a big boomer demographic, and there was not enough people to fill the roles, to offer the care. Recruitment, retention, resources, planning, poor planning. I mean, how come nothing has been done in so many years? What do you think is the obstacle there?
I think it comes down to accountability, and we at CAPE, we're coming out with a position statement on overcrowding very shortly, and in it we highlight the key deficiency and the key implementation that needs to happen is accountability framework. We know about these things, but we don't have articulations of who is accountable for this, who is responsible for the various things that need to happen, be it home care, be it primary care, be it hospital flow. What are their deliverables, and what are the consequences for not achieving that? Without that kind of framework, we can talk about all these problems as much as we can, but we won't have a clear understanding of who is responsible and what are they responsible for. So fundamentally, that's what needs to change at every level of healthcare delivery, be that hospital, health region, provincial, and national, in order to give Canadians the healthcare and the emergency care that they deserve.
Well, you know, you're on the front lines, Dr. Herman, and I know that certainly you mentioned that it doesn't come as a surprise to you, and so many other physicians in your position as well. They would say, we saw this coming for years and years and years. So to your point there about an accountability framework, what's taking so long in having that accountability or having something be done? Is there not the will from whether it's the levels of government or the people involved in this to make that change happen? Because it has been a prolonged problem that has only become worse with time.
No, you're exactly right. And as to the question of will, I would turn that question to our hospital CEOs, to our health region leaders, to our provincial and federal elected officials. Where is the will? Where is the push to get this accountability? And I think we as a population, as Canadian citizens, need to hold our leaders to account to provide this and to provide the resources that are necessary for timely, high quality delivery of healthcare, both within the emergency department and outside of it. So I encourage everyone listening, write to your local officials, write to your representatives, and demand things be better, because they can be better if we push for it.
And how much worse do you think it can get? Because this is just a picture of the decline. We know that the aging population is continuing to grow now. What do you think it's going to look like in another 5 years if drastic action isn't taken right now?
I think we're going to continue to see the pattern of devolution that we're seeing, increased wait times and the mortality that comes along with it, because waiting in the emergency department for an inpatient bed truly has mortality risk associated with it. So without those changes, without the ability to get those patients out of the emergency department, we're going to continue to see risk to our patients. We're going to see increased delays, and we're going to see all the bad outcomes that come from that. But I do want to say that there is still chance for optimism. There is still chance for hope. Things are the way they are now, not because of inevitability, not because it is the way things are ordained to be. These are a result of policy choices. And the solution to bad policy choices is good policy choices, which I think is something we need to demand of people from top to bottom in our healthcare system.
Finally, Dr. Herman, I wanted to ask you, for you and your colleagues, how helpless do you feel when you see all of this happening?
It can certainly be discouraging, and to come onto a shift where half or two-thirds of your inpatient beds are occupied by admitted patients, limiting your ability to see that next undifferentiated emergency patient, it can be very disheartening. It can be a big cause of moral injury and burnout. But I'm so proud of my colleagues, my team, the people that are working in our nation side by side every day to, in spite of these austere conditions, provide great care to Canadians. So I take faith and I take hope in the fact that despite all of these challenges, we're still out there on the front lines looking after Canadians. And now we need our partners in the healthcare system to come meet us in that delivery.
Dr. Herman, I very much appreciate this conversation. Thank you so much for your time today.
Appreciate you having me. Have a nice day.
That is Dr. Michael Herman. He is an emergency physician and spokesperson for the Canadian Association of Emergency Physicians. He joined us today from Ottawa.